It was a year like no other, but I also really think we have a team at Hamilton Health Sciences like no other, and you should all be super proud of what we accomplished together.
Some good news to report this week in that we're up to 80% of our pre-COVID volumes for surgical care and 74% for our procedural care. So that's fabulous. Some of the pressures that impact our ability to ramp up are related to the requirement to maintain critical care capacity. All hospitals are required to do this within the province, as well as our unique requirement related to ACMO. And again, we have finite resources to manage this additional capacity, which is why we continue to require some of those deployed staff to maintain, so we are able, if necessary, to continue to ramp up.
The decision has been made that by Monday after the weekend, we will change the remaining policies into low epi as well. The changes now, which are the last ones to get back into our low epi policies, will be to stop pre-procedural asymptomatic routine testing, with the exception, obviously, of patients who come from higher epi regions. For us, the only relevant at this point of time is the region of Waterloo, where we would still recommend to get them tested, and no longer to require a test if symptoms can be explained by an alternative diagnosis.
We're now in the middle, about 2/3 of the way through phase 2, which is this critical phase where we're going to put the HHS stamp on the Epic Canadian Foundation and build the system designed to work in the HHS environment and the unique aspects of our institution. We are on time and on budget, and as of today, we are 344 days from go live.
Our infection prevention and control team members were also really critical to supporting all of these efforts during some very challenging and dynamic times. It was such an enormous challenge to be both learning about the virus and developing policy in real time to keep our staff safe, all in the context of a very unreliable PPE supply chain and PPE shortages. My sincere thanks to everybody for your commitment and contributions towards what's been achieved over this past year. I am super proud of the organization.
Really encourage you to please report your vaccination status to Employee Health Services so that we have a good understanding of the breadth of vaccination in our own organization.
We're off until July 8th, and I'll see you all at the July 8th Town Hall. Cheers, everybody.